The next chapter we're going to discuss is chapter 34, diabetes mellitus. Objectives is to explain the cause of type 1 diabetes mellitus, compare and contrast types of insulin, describe the signs and symptoms of insulin overdose and underdose, explain the cause of type 2 diabetes mellitus, compare and contrast the drug classes used to treat type 2 diabetes mellitus, identify drug examples, and explain their mechanism of action, primary actions, contraindications and precautions, interactions, and the important adverse effects. Okay, as we know, diabetes, this is a good slide that you need to know, because remember the three cardinal signs of hyperglycemia, which is your 3 P's, polyuria, polyphagia, polydipsia. So they're peeing lots, eating lots, and drinking lots of water. Patients may be tired. They'll obviously have the frequent urination. Hyperglycemia uncontrolled diabetes causes weight loss. Wounds are not going to heal as quickly. They may have sexual problems. They're always hungry. May have blurred vision, could be hypo or hyper as far as that. Uncontrolled leads to numbness and tingling of the hands and feet, which is your diabetic neuropathy. And then your blurry vision can lead to diabetic retinopathy. They're always thirsty, and then vaginal infections for females of yeast infections that they can get with uncontrolled blood sugars. Okay, introduction: chronic illness that results from an absolute or relative deficiency of insulin. So type 1 is considered juvenile diabetes, is what the old term was. So this is diagnosed at a younger age. They are producing no insulin. The pancreas is producing no insulin at all. Type 2 is typically diagnosed later in life. They may have a pancreas that does not work at all of secreting insulin, but typically your type 2s are secreting some insulin. It's just not being used effectively in the body. So a lot of people start out as insulin resistant and then move into full-on type 2 diabetes. The different types of insulins are rapid, short, intermediate, and long-acting. So please make sure you take a look at their onset, peak, and duration for these medications. So your long-acting, just remember that it's usually given just once a day, typically at bedtime. But the Levemir, or the insulin which is underneath other medications, the Levemir, it can be given with an evening meal or at bedtime. And then your other ones are going to be given within 15 minutes or so of the meals given. So make sure you just look at those, please. Oral medications can be given along with insulin. And then there's newer injectable to supplement insulin or oral agents to manage glucose control. Okay, so knowing your different types of insulin, you have your rapid, which is your Lispro, which is your Humalog. Short acting is regular insulin, and when anybody's in hyperglycemia or DKA, regular insulin is what they're going to give. Intermediate acting is your MPH, which is your cloudy insulin, and then your long acting is your insulin glargine, which is your Lantus, or they can do Levemir. Action of insulin is to promote the cellular uptake of glucose, converts glucose to glycogen, and moves the potassium into the cells along with the glucose. So when you have potassium out in the system itself, that's what causes in DKA. That's what occurs is your glucose and your potassium are all out of the cells and into the vascular system, and so that's why the potassium is high and the glucose is high as well. Insulin is used for glycemic control to prevent complications, and then type 2 can require insulin. Okay, so looking at these slides, hyperglycemia, so please make sure you know these. Increased thirst, headaches, difficulty concentrating, blurred vision, frequent urination, fatigue, so they're feeling tired and weak, and weight loss. Insulin complications, Also, with your we'll talk about this. Sorry, hypoglycemia. What can cause hypoglycemia? Giving too much insulin can cause it. Giving insulin and them not eating can give it. So it's anything below 60. I realize your book says 70. Vomiting, diarrhea, alcohol intake, childbirth, and then strenuous exercise, because they're using all of those glucose stores. So then your blood sugar is going to drop. So as the nurse, you need to monitor for hypoglycemia. The client they're going to experience a sympathetic nervous system effects. So they're going to be tachycardia, palpitations, diaphoretic, shaking. If it's more gradual, they may experience a headache, tremors, weakness, lethargic, disorientation. But the top ones, if it abruptly starts, then that's what you're going to see. So you're going to administer glucose to help, and you want to administer 15 grams. So 4 ounces of orange juice, 2 ounces of grape juice, 8 ounces of milk, or they can do glucose tablets per, just read the directions, the labels. If your patient is alert and can eat and swallow without aspirating, you can just feed them. Just make sure you stay within that 15 grams. Otherwise, we may have to be given IV glucose, which we will talk about at the end. And encourage these people to wear a bracelet. So then the next thing is your hypertrophy. This is a lump of fat. Is also on the back of your neck is where you'll see it. But that will also build up in the injection sites. So you want to make sure that you allow about 1 inch between the injection sites. Stay at least 2 inches away from the belly button when giving those injections. So nursing considerations, monitor for your hypoglycemia, monitor your glucose orally or parentally, wear the medical alert bracelet, and then always have a snack on hand. Interactions, sulfonylureas, meglinides, beta blockers, alcohol, thiazide diuretics, and glucocorticoids. Nursing considerations, mixing your long and or short and long, which is your clear to cloudy. Nursing suspensions, NPH, subcu tissue absorption, so it increases from the thigh to the upper arm, so your thigh is not going to absorb as well as your upper arms. So just remember that. Also, I just kind of want to talk about, I'll talk about it here. Okay, oral antidiabetics. So this is all classifications for the oral. It's going to control your blood glucose levels in clients with type 2. Follow appropriate dietary guidelines and exercise consistently. So one of the complications that can occur as well with what insulin is used for, so we talked about regular insulin, is diabetic ketoacidosis, and then also there's hyperosmolar hyperglycemic non-keto syndrome, which these are emergencies. Blood sugar for the second one is over 600. You're going to have an increase obviously in glucose in the urine as well as ketones in DKA. But your blood is going to become more thick. The kidneys are not going to be able to fix the problem. They cannot achieve that homeostasis when your blood sugar is that high. The blood sugar and the potassium and sodium is imbalanced. This can lead to heart dysrhythmias, seizures, coma, organ failure, and then eventually death if it's not corrected. Definitely correcting the hyperkalemia is a big thing to prevent the heart issues. Okay, so the first group that we're going to talk about is sulfonylureas, which is your glipizide, your glyburide, glimepiride. So these are going to release insulin from the pancreas. So all these medications that we're going to talk about is going to release a certain amount of insulin from the pancreas to help control of what they need. Complications, hypoglycemia, so just make sure you know the signs and symptoms, and this is going to be for all of them. Weight gain as well. Because even once they get their blood sugars under control, a lot of people will start putting weight back on that they had lost previously with their blood sugars being high. Contraindications, pregnancy risk category C, precautions, kidney failure, hepatic dysfunction, or heart failure. Interactions, glipizide is alcohol, NSAIDs, sulfonamides, antibiotics, so anything with sulfa, ranitidine, and cimetidine, and beta blockers. So client education that you're going to do is obviously have them monitor for hypoglycemic or hyperglycemia. So then that way they can report it, or if they need to, if they're high, that they need to go to the ER. And always keeping a snack on hand, wearing a bracelet, medical alert bracelet. So. Meglinides, which is your Prandian, will release your insulin will release from the pancreas, your hypoglycemia and weight gain once again. Pregnancy risk category C, and then your kidneys, hepatic dysfunction, and heart failure. Gemfibrozole is an interaction of these. The next one is your metformin, which is biguanides, which you're more familiar with. Action is going to be reduce the production of glucose within the liver through the suppression of gluconeogenesis. Increase muscles glucose uptake and use. And then this is typically the first choice of medication for type 2 diabetes. It also can treat polycystic ovarian syndrome, PCOS. Complications are gastrointestinal effects, which if they become nauseated with this, then they can take it with food to help decrease that, as well as if you have somebody that has a hard time swallowing, they do make, as long as it's not an extended release form of metformin or the glucophage, they actually can crush it and dissolve it in water or put it in something to take it. Vitamin B12 and folic acid deficiency, especially with your pregnant women, they need to be more careful because obviously folic acid the women need that folic acid, but it can cause alteration in the absorption of the metformin. And then lactic acidosis, so hyperventilation, malaise, which is your muscle pain, sluggishness, somnolence. This does have a 50% mortality rate. So you need to withhold the medication, and then if it becomes severe enough, they may have to have hemodialysis. Contraindications. Pregnancy risk category B, avoid in pregnancy and lactation, severe infection, shock, and hypoxic condition, and alcohol use disorder, kidney failure, hepatic dysfunction, or heart failure. Interactions is alcohol, iodine containing contrast media, and then they can take this with food. Actose, which is your thiazolinides, so glitazones. This will increase the cellular response to insulin by decreasing insulin resistance, increase the glucose uptake, and decrease glucose production. Complications, fluid retention, so monitoring for edema, any weight gain, so daily weights, which can also indicate heart failure. So elevations of low density lipoprotein, so make sure they monitor cholesterol levels and modify their diet and exercise. Bladder cancer, so for signs of that, hematuria, which is going to be typically the first thing that people will notice, urgency, and then dysuria, which is difficulty urinating. So they need to let their provider know as soon as possible. Ovulation and anovulatory premenopausal females. So they may just need potential for ovulation and contraceptive options. Fracture in female clients, So we need to be measuring the bone health, so bone density exams. They may need to increase their calcium and vitamin D. Hepatotoxicity, looking, grabbing baseline liver enzymes, and then periodically testing the liver functions throughout. Also reporting any jaundice or dark urine. Contraindications, risk category C, severe heart failure, history of bladder cancer, and active hepatic disease. Precautions, mild heart failure, older adults. Insulin or interactions, torvastatin and conazole, rifampin, and citidine. And then they can take once a day with or without food. Precose, it slows the carbohydrate absorption and digestion. Complications, gastrointestinal effects. Once again, they can take this with medication if they need to help decrease those effects. Because they may have abdominal distension, cramping, hyperactive bowel sounds, diarrhea, excessive gas. So discontinue the medication if they need to. Anemia due to decreased iron absorption. So monitor the hemoglobin and iron levels. And hepatic toxicity with long-term use. So once again, your liver functions test need to be monitored. If this occurs and the patient is discontinued off of the medication, then the liver function test will go back to normal. Okay, contraindications, pregnancy risk category B, gastrointestinal disorders, precautions, kidney disease, hepatic dysfunction, or heart failure, interactions, sulfonylureas, or insulin and metformin. And then once again, hypoglycemia, wearing bracelets is what you need to instruct them on. Okay, Januvia, which is your DPP-4 inhibitors, gliptins. Hormones promote the release of insulin and decrease secretion of glucagon. Lowers the fasting and postprandial blood sugar levels. So make sure you remember what postprandial means. That means after a meal, and it's typically 2 hours after a meal. Complications are generally well tolerated medication. Pancreatitis, so making sure that that we are looking for severe persistent abdominal pain with or without vomiting, then they need to just stop this medication immediately and notify their provider. Contraindications, pregnancy risk category B, avoid in pregnancy and lactation. Precautions, kidney failure, hepatic dysfunction, or heart failure. There's no real significant interactions. And then they can take this once a day with or without food. Okay, Invokana, it's used in combination with insulin for type 1 diabetes, limits the rise of glucose postprandial, excretes the glucose through the urine, and promotes weight loss. Complications, cystitis, which is inflammation of the bladder, candidiasis, which is your yeast infections, and polyuria, which is excessive urination in female clients. Dizziness and risk of hypotension, so make sure changing positions slowly, and then not doing anything with heavy machinery, driving until they know how the medicine's going to affect them. Contraindications, pregnancy risk category C, and then kidney failure and undergoing any dialysis. Precautions, kidney failure, hepatic dysfunction, or heart failure. Interactions, rifampin, phenytoin, phenobarbital, thiazides, or loop diuretics. And then education, take once a day before the first meal of the day. Clients, for all anti-diabetics, exercise and follow dietary guidelines, maintain a log of the glucose levels, meet with a registered dietitian or a diabetic educator to get more information. And then the formulations can be combined of 2 medications, knowing that they can be on insulin and an oral anti-diabetic to help control blood sugars. Okay, incretin mimics. This is your Byetta and your Trulicity. Like I said, the liraglutide, that's your Victoza. These medications help promote the release of insulin and decrease the secretion of glucagon and slows the gastric emptying. Fasting and postprandial blood sugar levels are lowered, and it helps decrease the appetite. So a lot of times this one will help people lose weight because it decreases their appetite. Supplemental glucose control for clients who have type 2. It's used in conjunction with an oral anti-diabetic. Complications, GI effects. Some people will complain that they are nauseated. So what they can do, physicians can prescribe Reglan to help combat the nausea due to the medications. Also, pancreatitis, so just withholding the medication and notifying their provider. Contraindications, pregnancy risk category C, severe kidney impairment, severe GI disease, or history of pancreatitis. Older adults in kidney impairment or thyroid disease are precautions. Interactions, oral contraceptives, antibiotics, and acetaminophen, sulfonylureas. Nursing considerations, pre-filled injector pens, so they dial them up to the 5 or 10 is what Byetta comes. It needs to be given within 60 minutes before the morning and evening meals, and this needs to be kept refrigerated and discarded after 30 days. So even if it's open, if they go out to eat or something, then they need to take it and put it like a cold pack on it because it has to stay cold. It can't come to room temperature. As well as, like you guys know, your other insulins, your vials or pens, your Humalog, anything like that has to be refrigerated. If it's unopened, just refrigerate it, and then once you open it, those don't have to be refrigerated, but you discard after 30 days, or sometimes they'll tell you 28 days. Okay, hyperglycemic agent. This is glucagon. It'll help increase the blood sugar, so if somebody is hypoglycemic, this will help. This is used for emergency cases. GI distress is a complication, nausea, vomiting. So just turn them on their left side to reduce the risk of aspiration if they do have emesis. Contraindications, inadequate glucagon stores. So if there's starvation, do not give it. Pregnancy risk category B. Hypoglycemic, make sure you guys know what the signs and symptoms are. Precautions, cardiovascular disease, and nursing considerations, administer sub-Q, IM, or IV. Provide food when fully conscious and able to swallow. Maintain access to glucose and glucagon kit at all times.